We spend the most money on healthcare, but it's not translating into the results that we need, which is for people to be able to enjoy their pregnancy and birth experiences, survive their pregnancy and birth experiences, and to be able to leave hospitals or birth centers with their babies. The midwifery model of care is quite different than the allopathic medicine and models of care that we use here within the US with obstetricians and gynecologists. And obstetricians are really trained as surgeons. And so their training really positions them to focus on and address abnormal progression of labor and abnormal pregnancies. Midwives are really trained to support the natural progression of labor. I think that's for so long, there was such a focus on pregnancy. And I think that this actually has to do with our focus and attention on infants and the babies, right? That really being like the woman being a vessel for this life, right? I think that's
Right.
indicative of our focus on the infant, the baby.
To just impress upon people how absolutely vital the 4th trimester is, and that the health of the baby really depends upon the health of the mother. Are Black women just straight up not seen as human beings as much as their white counterparts?
It's why CDC developed in collaboration with several partners the Hear Her campaign. And
Mm,
that was to address the fact that Black women are not listened to. And that is the root of that is not seeing, valuing Black women and Black people, certainly. My mother took them, and she talks about how she had to contend with the staff misinterpreting that they were looking for like drugs. They just wanted opioids. They're reporting to the hospital for care, but because they're Black, because they're a male, he was male, just having this perception that they are.
and too often, we feel like it doesn't really matter what we think or what we have to say or what we went through or what happened to us, and we stay silent.
Storytelling is a huge component of many of our programs and how we engage in narrative shifting. And that's why I feel empowered and motivated in the work that I do because I can see the narrative shifting. But majority of those deaths, 80%, are deemed preventable. So this is an issue that we can fix. So this is an issue that we can fix.